Today's date is July 16th, 2019. We're here with Ralph, who drove all the way up here from Southern California to see me. Ralph is an electrician and a very wise one. He understands the impact of EMF. He's very concerned about the impact of 5G. This is his profession and his field, but he's here because he has some issues. He wants me to evaluate his neck, and he's got a lot of dental issues. And we just got done testing a lot of missing teeth and a couple root canals. We found two fields potentially positive. One is sort of half of a tooth left in number 6, and also 32, which would be a missing wisdom tooth. And I should have videoed you beforehand, but show the viewer what your range of motion was like before we injected number 6.
So before it was about 45 degrees, like maybe here.
It was about to there.
That's struggling.
Yeah. So then I injected it, and you were blown away. Show the viewer what you can do now.
It's like easy 90 degrees. I mean,
not quite 90, but it's better.
Well, if it's major difference.
It may. You're happy, nevertheless.
Oh, absolutely.
Right? Okay.
Yeah.
And did you expect this? You knew it was a possibility.
Not that dramatic.
Okay.
I mean, this is dramatic.
All right.
Yeah.
Now, for the viewer, bend your head down. Okay, you can go all the way to chin to chest now, but before we did that, bend your head down.
Yeah, it was about.
That's about as far as you could get.
There, yeah.
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 So there's a significant improvement in flexion, and you would have been happy if I injected your neck with ozone, but I have to do the teeth first because the teeth could be a significant problem.
Yeah.
So we'll go check number 32 now. You told me also that you had prolotherapy for your neck, which is injections of substance, irritants,
Right.
and it was not nearly as effective or as what we just did with your tooth.
Right.
Is that correct?
Right. Yeah.
Okay, and that's expensive, and it was not comfortable.
Expense. It's an understatement.
Okay.
And you can count on $700 to $1,000 a pop.
Turn your head to the right, please, as far as you can. Now turn it to the left as far as you can. That's even better now. That's a little bit better with that one. Okay.
Yeah.
Bend your head back as far as you can, and bend it down as far as you can. Now that's pretty good. You were not able to do that before. Okay.
Right.
About your take on what happened to your neck with the tooth injection?
Well, the what do you call it?
Regarding your expectations?
Well, the range of motion that I have recovered, it far exceeded anything I had with weeks of physical therapy for whiplash that I had. It's just unbelievable, but you can't deny it because I can do it.
Oh yeah, that's impressive.
Yeah.
Okay.
I wouldn't have expected that because I would have thought that the physical therapy should have brought me back to something like that because I used to have it. I used to have it before 2 whiplash accidents.
Well, you know the improvement's not going to be permanent because this was just a test. All we're doing is testing and temporarily taking it out. And you're an electrician, so you can definitely understand that, right?
Right.
Okay. May I post this on YouTube?
Always, yeah.
Thank you. We just did your neck. So I want to see you turn your head to the right, please, as far as you can.
Okay.
Now turn it to the left as far as you can.
It's a little better.
That's a little better yet. Okay. Now bend it back as far as you can. And bend it down as far as you can. That's pretty good compared to what you came in with. All right, turn your head side to side and tell me how it feels overall, like this.
Just back and forth.
Yeah. How does it feel?
Well, one thing I noticed is I can do it faster. Before it was like, and you're really stressing, but this is
that was quick.
This is it's easy. I really noticed it driving, and I mean, if you're going to be attentive driver, you got to look left and right
quickly.
Your mirrors, if nothing else, and it just was annoying. And it also kind of takes your attention away from other stuff you're doing.
All right. Well, we did some good stuff here. So you're going to see a dentist.
Yeah.
We found, and interesting, we found 2 initially. Then we cleared them, or we put some Procaine in.
Right.
And then when that happened, we found one more.
Yeah.
And as an electrician, it makes sense to you, right? When we fix two circuits,
Right,
you
right.
find the next bad
Right.
circuit.
Right. It's
Okay.
all a network. Yeah.
Thanks very much.
Yep.
This is Wednesday, July 17th, 2 days after we first did Ralph. And his neck is still better, right? You're driving
Oh,
better?
yeah, absolutely.
All right. Show us how far you can turn to the right, please. And how far you can turn to the left, please. Okay. The right is actually a lot more improved.
Oh, absolutely.
Okay.
Yeah.
And your flexion extension is good, but bend your head back. Actually, the extension is not the best, but bend down. That's much better than when you walked in the door. So we're going to do, okay, we're going to do your tooth now. We just did tooth number 6. Again, bend your head back, please. Now that is better. And bend your head down. Okay, so I want the viewer to see that your flexion extension was 3264 for a total of 96, and it went up to 3870, which is 108. So you gained significantly in flexion extension.
Right.
Okay, and you could feel that.
And that's without straining.
Right. Okay. So you definitely noticed another difference today.
Yes.
Doing that.
Yes.
Okay.
I was checking it this morning, before I got here.
Yeah. Okay, you're going to need to get your dental work done. And I'm not the dentist.
I know, I am.
Thank you. And I may post this.
Yeah, sure.
Thank you. I also wanted your comments on the difference between what you've gotten here and what you had before prolotherapy.
Oh, well, I spent a chunk of money on 2 prolotherapy sessions or episodes, 2 different times when I had whiplash incidents, and they were much more painful, many more shots, and from what I've experienced now, not as effective.
Okay.
Yeah.
Not as effective, much more painful.
Yeah.
And the pain probably lasted a couple days because it gets worse over the next day or two.
Right. Yeah.
Okay.
And I haven't experienced this with the previous one and today.
And this is light by almost nothing by comparison.
Right.
Okay, thanks. I just wanted the viewer to know that. I have gotten better results with this than with standard prolotherapy. It's kinder and gentler to the patient, it's kinder and gentler to me, and it's cheaper.
Yeah.
Okay, thank you.